Tight hip flexors are a thing that many athletes and lifters deal with, and is a thing that we see very commonly in the clinic. The first question is, what are the hip flexors? Broadly speaking, the hip flexors are a group of muscles that flex the hip, bringing the knee towards the trunk, or vice versa. Primary hip flexors are the iliacus and the psoas major, which basically form one muscle called the iliopsoas. Another important hip flexor is the rectus femoris, which is one of the four quadriceps muscles that crosses both the hip joint and the knee joint. Other secondary muscles that assist in hip flexion are muscles like the pectineus, sartorius, tensor fasciae lata, and the adductor muscle group depending upon the position of the hip. However, we're primarily going to be discussing the rectus femoris and the iliopsoas in today's video. The next question that you have to answer is, are your hip flexors actually tight? Tightness in a muscle group is just a sensation that you experience, and it may or may not be actually correlated with true muscular stiffness or a lack of flexibility. To figure out if your hip flexors are actually physically tight and limiting hip motion, we're going to use a test called the modified Thomas test. For this test, you're going to lie on your back on the edge of a table, grab one knee and bring it towards your chest, and let your other leg fall towards the table and the floor. Once in this position, we're looking at two main things. The first is the angle of your hip joint, and the second is the angle of your knee joint. If your thigh can't reach the table, then you might actually be dealing with true muscular stiffness and a lack of flexibility, and will likely benefit from direct stretching or flexibility work for the hip flexor muscle groups. If the knee is relatively bent in this position, then you're primarily dealing with an issue with the iliopsoas, whereas if the knee is mostly straight in this position, you might actually be dealing with a rectus femoris issue because that muscle is getting stretched across both joints. If your leg can reach the table relatively easily, then you're not actually dealing with a true lack of flexibility in the hip, and instead you're just experiencing a sensation of stiffness in the hip flexor muscle groups, and you don't necessarily need to do direct flexibility work or stretching to alleviate this. If your modified Thomas test showed a lack of flexibility in one of these muscle groups, then try the following stretching progression to address it. The first step in the progression will be a static stretch, the second step in the progression will be a dynamic mobilization, and the last step in the progression will be a loaded stretch. If your modified Thomas test showed an issue with iliopsoas flexibility, then try out the following progression. The static stretch that we're going to do in this situation is a half kneeling hip flexor stretch. To perform this stretch, you're going to get into a half kneeling position in which the knee of the leg that you're stretching is on the floor. From here, you're going to tuck your pelvis underneath you and push your hip and body forward until you feel a stretch in the front of your hip. Hold the stretch for at least 30 seconds before returning to the starting position. The next step in this progression is performing a dynamic mobilization instead, which you're going to do in the same position as the half kneeling hip flexor stretch. To do this mobilization, you're going to get in the same exact position as before, but have the same side arm reaching up and over your head as you push your hips forward, moving in and out of the stretch. You're going to perform this mobilization for 10 to 15 reps per set. The last step in this progression is a loaded stretch, which is going to be a variation of a front foot elevated split squat with the back leg farther back than you would normally have it. Try to lock your pelvis into the same position that you used for the static stretch and the dynamic mobilization as you perform slower controlled reps of a split squat. We recommend 3 sets of 8 to 10 reps per side for this movement. However, if your modified Thomas test showed a possible limitation in rectus femoris flexibility, then give this progression a try. The static stretch that we're going to use for this situation is a couch stretch. To perform this stretch, you're going to get into a half kneeling position as before, but this time the back leg is going to be elevated up on a surface such as a bench or a chair. Tuck your pelvis underneath you as before, and then push your hips forward, feeling a stretch in the front of the thigh and the front of the hip as well. Hold the stretch for 30 seconds before returning to the starting position. To progress past the static stretch and to move this into a dynamic mobilization, you're simply going to do the same steps but moving in and out of that stretch for 10 to 15 reps. And the final part of this progression is a band-assisted reverse Nordic curl. To perform this movement, you're going to get into a tall kneeling position with a light band attached to a squat rack in front of you. From here, you're going to tuck your pelvis underneath you as you did in the previous drills, and then slowly let your body fall backwards, only moving from the knees. You should feel a large stretch throughout the front of your thighs as well as the front of your hips. We recommend 3 sets of 6 to 10 reps for this exercise. If your modified Thomas test did not show an actual issue with muscle flexibility and a lack of range of motion, then you don't actually need to perform any of these stretches to alleviate your symptoms. However, you can absolutely still try them and see if they actually alleviate some of the symptoms that you are experiencing. But if they don't, you might want to try one of the following hip flexor strengthening exercises instead. The first is a band psoas march. To perform this exercise, you're going to lie on your back with the band around your feet and your legs flat on the floor or whatever bench or table you're laying on. From here, you're going to keep one leg straight as the other leg marches up, trying to bring your knee as close to your chest as possible. Pause for a second or two before returning to the starting position. The second is a cable hip flexion drill. To perform this exercise, you're going to attach a cuff around your ankle that is attached to a low pulley. From here, you're going to step forward so that the cable is pulling directly behind you, and you're going to hold onto a bench or other form of assistance for your balance. Once in position, you're going to drive your working knee up and forwards before slowly lowering back to the starting position. We really love this drill for people who are experiencing hip flexor stiffness because it challenges your hip flexor through a long range of motion, which can be very beneficial when dealing with this issue. And the last exercise is a long sitting leg raise. To perform this exercise, you're going to be sitting on the floor with your legs out straight and your arms behind you for support. From here, you're going to keep your knee straight and lift your leg up as high as possible, pausing for a second before slowly returning to the starting position. These 3 drills can all be performed for 3 to 4 sets of 6 to 15 reps depending upon your tolerance and capabilities. If you found this to be helpful, please hit that like button, leave any questions that you might have in the comments below so we can answer them, and make sure to subscribe to our channel for more future content just like this.